So let's talk those who can get vaccinated and have. Now we're on to the boosters. For some people, those 50 and over, it's their second booster shot now. So we're still waiting on those younger than 50 to be able to get their second booster. But my question to you is, are you seeing people, are they getting this booster shot? Because you hear, just in your own communities, oh, I got the two first initial shots, I'm done now. What are you hearing, and what's your advice to people kind of on the fence about getting that first or even second booster?
Yeah, I think clearly, the most important is that for everybody who has not yet gotten vaccinated to please go get vaccinated as soon as you're willing to do so. I think it protects you. I think it can protect your friends and family and community members. And I think we have less than 50% of our friends and neighbors who have gotten their first booster shot. And I think that's really the important booster to get. We're seeing that immunity does wane after several months after the original vaccine, and the booster shot does give us longer protection against infection and certainly against severe infection that we're all concerned about. So to everybody who has not yet booster shot, and it's a lot of people who have not yet, please think about going and getting your booster shot. You can go on vaccines.gov to schedule your appointment. Most of the pharmacies are doing walk-in visits now. It's not like the way it was, back a year ago when getting appointments was so difficult.
Right.
Something we were all struggling with. I think with regards to the second booster, I've certainly seen a mixed picture amongst my friends and family and my patients. And I think it does provide some short term, I think in the data that we have from Israel, 8 to 12 weeks of increased protection. So I think it can help a little bit. I think for people who are really on the fence about the second booster, it's really, everyone's individual decision. If you do have an exposure coming up, let's say you're going on a big trip, you have a big occasion coming up. I know a lot of people have postponed weddings and parties, right? It may be worthwhile to get yourself that temporary protection of another booster shot. But for the people who are really concerned about it, I think certainly getting your original vaccine series and the one additional booster 5 months later is what we're thinking is the most important at this time.
Well, let's talk about, the level of protection from those booster shots and how long that immunity lasts from them. One of our viewers is weighing in on this as we have this conversation. Dee wrote, a lot of people who are still getting COVID, even if they get vaccines and boosters. So what would be your response to Dee?
Yeah, I think it's true. A lot of us are still getting COVID, and that's unfortunate. Our hopes when these vaccines came out is that they would be sort of the end to this virus. I think what we're seeing is that the virus is adapting as we are, and thankfully, most of the illnesses that we're hearing about now and seeing in our friends and relatives are not severe infections. They're more of like a cold or flu, which is certainly nothing that any of us want, but thankfully hospitalizations, severe illnesses, and deaths are not up despite the rise in cases. And I think that's largely due to the vaccines and due to the fact that the infection itself has changed. I think one of the most interesting studies that I've seen looked at how much virus is present in people's noses versus in their lungs. And I think with the original illness, the infection really had a proclivity for the lungs, making people ill with things like pneumonia. And I think now the virus is really more of an upper respiratory infection, giving people more of a cold and flu type illness, which is certainly a drag, but thankfully nothing life-threatening in the vast majority of people.